So tell us where, I mean, you shared kind of with the NIH and what's going on with Duke University, which is incredibly exciting, but maybe talk about where the company is at currently in fundraising and in the R&D, what in terms of R&D and what the goal is moving into the next 1 to 2 years.
Okay, great questions. As far as R&D, we do have a automated MVP device that has a Bluetooth connection that will transmit to your phone. And so, you can take your phone and you can control that. Actually, we do have the decentralized clinical trial device controller. I think I actually could pull it up real quick. So it is, the system is already, yeah, here it is. So for example, when you get your system, you got your QR code, you put your QR code in, it keeps your ID away. So we're HIPAA compliant, we're trying not to transmit any user information. Then you check your condition. So you've got your condition and you can go to whatever one of your conditions that you have and select it and enter it. Then you have your temperature control. So right here, we've got our temperature control. I could sit here and show you how this works all day and you probably can't see it too well, but needless to say, we've got 5 biomarkers on there. So you can report, how did you sleep? How many opioids did you take? How's your urinary pattern changing? How is your, what was the other one? Pain, restroom, sleep, and opioid use. So, again, as far as R&D is concerned, we're planned for having that capability. I've got to speak with my electronics team next week to figure out how we can take what we have on the breadboard and reduce it to a microcontroller and start to work on engineering. As far as fundraising is concerned, between the NIH, yours truly, bootstrapping, and state matching funds, we've raised well over $500,000 to date. We've been very frugal with those funds to try to extend them as far as we can in the things that really matter. We are interested definitely in smart money. If smart money comes to the table that really has an interest in what we're doing and wants to make a difference, and someone that's probably involved in impact investing or value-based care or women's health, these are 3 topics that are probably going to pique the interest of those, if that's the thesis of the investment bodies. And
for those that are listening that aren't in that, that raising capital ABC funding world, so to speak, maybe you could define smart money for them real quick.
Sure. Smart money. Okay. So when we talk about all different kinds of investing, we've got venture capital, you've got private equity, you've got family offices. By the way, we're very interested in family offices. I think that's probably where we're going to find our first tranche of investments. But smart money is, there's lots of money out there. We all know there's lots of investors, but investors have thesis, they have timelines, they have boards they have to answer to, and typically they're about 5 years, sometimes 6 or 7. And there's a performance metric on that. It starts a clock ticking, and for a medical device company that can't get off the ground as fast because you've got to go through regulatory and FDA and all the other approvals that you have to get through, it takes a little longer for med device. So it's almost like shooting yourself in the foot, and so, to some degree, for a small startup to get involved with VC money that has those kinds of pressures so early. So that's what I mean by smart money. Means the people that understand the space you're working in. And for example, a good friend of mine has invited me to speak at LSX in London next in April. So there's
I'll see
you know the guy. I think you might know the guy. But anyway, that's a really good opportunity to tell the story and run into those people that are serious about what we're serious about. And so money's money. Money's all the same. It's just, are these the people that have the connections that can help you get to market faster, better distribution, better connections, that in many ways is probably as valuable, if not more so, than the money itself.